Hello, this is Dr. David Green, CEO of the Colorado Pain Network. The topic today is the basics of kyphoplasty for vertebral compression fractures. Vertebral compression fractures occur over 700,000 times each year in the U.S. Most are due to osteoporosis, and a significant amount of them are not painful. They go unnoticed. Half of women and 25% of men will have an osteoporotic fracture in their lifetime. Once a compression fracture occurs, the risk of additional fractures in the adjacent vertebrae goes up fivefold. Symptoms of VCF: sudden onset of back pain can occur. Back pain that worsens while standing or walking might cause limited spinal mobility, and there may be some height loss, deformity, and or disability, especially if you have a fracture here, then you may have one above and below. It can start to have somebody leaning forward, okay? There's a downward spiral. You have the spinal fracture. It leads to some back pain and deformity where the person ends up leaning, forward permanently, which can actually push on the person's lungs, impair function. They can start to lose appetite because it's pushing on the stomach. It can cause problems with sleeping, less activity, which can lead to more bone loss. They already have osteoporosis. They're making it worse. Fracture risk goes up, and it keeps going up. And by the end of this spiral, you have a significantly increased potential for mortality. The treatment options for vertebral compression fracture: benign neglect is when you just simply watch it and wait to see if the pain goes away. Medications over the counter can be nonsteroidals, Tylenol, pain medications like narcotics, muscle relaxers for the spasms and aching, and then spinal bracing, such as you see here. This is called a Jewett brace. The vertebroplasty procedure was invented in the 1980s, and this was initially for treatment of fractures due to cancer. In the 1990s, they started using it for osteoporotic fractures. It's an outpatient procedure. It's low risk, and it can give instant pain relief. You can actually see the entrance this is the spinal canal, so you want to stay away from that. It goes through this area called the pedicle. This is the back of the person. This would be the front of the person, and it goes through here, and you basically inject cement into the fracture. The kyphoplasty procedure is simply an evolution of the vertebroplasty procedure. It was FDA cleared back in 1998. It took about 5 years to really increase in popularity. It is very similar to vertebroplasty because you're putting bone cement into the fracture, but before you do that, a balloon is inflated with saline to push the fracture fragments out of the way to create an area for this cement. Here's a cartoon. Basically, you put the catheter in to the fracture, the balloon gets inflated and it creates a void, and then you take that out, and then you slowly put in the bone cement, and then you get a nice filling here, and it can help with restoring the height that was lost to the vertebrae. Outcomes: typically patients get immediate pain relief. There can be some aches and spasms that continue for a few weeks, but most of the pain resolves right away. Over 90% of patients see a dramatic pain relief with significantly increased function, including walking and the ability to perform their activities of daily living. There have been some studies showing questionable benefit, but they are far outnumbered by the ones showing incredible pain relief. The top pain management clinics in Colorado is Colorado Pain. They offer comprehensive pain management at several locations, including Metro Denver, Buena Vista, South Granby. Over 50 insurances are accepted by the board-certified pain management doctors who offer medication management, along with interventional procedures such as kyphoplasty. The number to call is 720-306-9575, and visit us on the web at painmanagementdenverco.com. I'm Dr. David Green, CEO of the Colorado Pain Network. Your pain stops here.